Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is Understanding and Addressing Mental Health on Campus, Opportunities and Challenges in Higher Education, and it is presented by Sarah Lipson.
So the learning objectives for today are threefold. We are hoping that folks will come away from this with an understanding of the significance of college student mental health from the individual, institutional, as well as societal perspective. So understanding why this is such a key population for thinking about mental health. Secondly, to be able to identify the state of campus mental health in terms of prevalence and help seeking and what we're seeing in terms of trends over time, as well as inequalities. And lastly, to recognize opportunities for investing in student mental health and the connection between well-being and academic performance. So even though we have seen decreasing levels of stigma, increasing levels of knowledge, and increasing levels of help seeking over time, there's still a really significant mental health treatment gap. And the treatment gap is actually a quantification bringing together both of these outcomes of interest. It's prevalence as well as help seeking. So among students with apparent need, so with a positive screen for depression, anxiety, or suicidal ideation, among those students who has not sought help. So that is the treatment gap. It's among students with apparent need who have not sought treatment. And that is not to say that, all students of, the 41% of students last academic year who screened positive for depression or the 34% who screened positive for anxiety, not every one of those students necessarily needs one-on-one counseling or therapy. There certainly is a group of those students who would likely benefit from that, but there are a lot of other approaches to addressing mental health that we can think about in this treatment gap. Again, and not a one-size-fits-all approach, but how do we, for those, 40%, 41% of students with depression, how can we link them to some sort of services or resources that could be helpful for them? Another problem in this treatment gap is the fact that many students, when they do seek help, eventually are doing so in a crisis. So they're, delaying seeking help until their mental health is in such an urgent need that it finally rises to be a priority and they go and seek help. This is putting even more of a strain on the counseling center, and it's really a missed opportunity for early intervention and prevention. Oftentimes, there's outcomes that maybe could have been avoided in terms of academic outcomes, social outcomes, certainly, well-being that might have been preserved or suffering that might have been able to be reduced. And so we want to be able to identify students early on and have resources that are available to them and try to reduce the fact that so many students are only seeking help once they're in a crisis. Many students who do seek help for their mental health are identified by peers and other gatekeepers. As I mentioned, stigma has gone down and many students are really open to talking about mental health. I'm also going to talk about the role of faculty, as I mentioned. And so I think many of these gatekeepers, staff, faculty, and students, certain staff roles on campus have had less prominent access to students throughout. So just to kind of summarize the state of campus mental health and what we know, high and rising prevalence rates. So we have mounting evidence of upward trends over the past 5 to 10 years. There's a confluence of factors that can help to explain this. Some are mutable, others less so. There's sort of this paradoxical truth where we've seen significant increases in student help seeking in recent years, but there's still this significant treatment gap that exists in terms of unmet need and the disparities therein. There are many opportunities for a more efficient delivery of campus mental health services and a need for early intervention, again, during this epidemiologically vulnerable time. There's also a need for resources to support faculty and staff mental health and well-being. Our data show that faculty and staff are looking for their institutions to step up and prioritize employee mental health and well-being.
I also invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.